Hey, thanks, Adam. Dr. Michael Kuhlenschmidt from Christie Clinic is here now to make the morning rounds, and this is going to be a fun one. Yeah, good morning, sir.
Good morning. Thanks for having me.
Of course. We talked last week with Dr. Deem about the flesh-eating bacteria, and now we're going to talk about a deadly fungus.
That's right.
Yeah.
So, over the last decade, there has been the identification and emergence of a particularly dangerous and resistant fungus called Candida auris. So Candida is a genus of fungus that people are probably familiar with, whether or not you know it by name. So things like vaginal yeast infections, thrush in the mouth, and other kinds of common infections can be caused by certain Candida species. But what we're talking about is a different one.
Different kind of strain? Or
yeah, it's a different species of it called Candida auris. And it was first identified in Japan in 2009, so a decade ago. Probably dates back further, possibly to South Korea. That's not all that important, but it is in the United States now, and actually particularly in Illinois.
Okay, so what exactly is it? What does it do?
Yeah.
You know, what's the...
So this is on the list of things that you don't need to lose a whole lot of sleep about because it's rare. It typically affects patients that are hospitalized or have been in nursing homes, particularly nursing homes that do acute care, like manage mechanical ventilation or things like that.
Yeah.
So it's spread in the sickest populations who have the most medical issues and have been exposed to lots of antibiotics or antifungals that then can acquire this infection and it can develop the resistance, which is characteristic.
Sure. So what are some of the signs and symptoms that if you do get infected with it?
Sure. So the signs and symptoms are going to be organ dependent. What we really worry about, though, is Candida species are spread through the bloodstream, and they can affect almost any organ system. And they can cause an overwhelming sepsis, just like a bacterial infection like necrotizing fasciitis. And so they can be very difficult to treat, particularly this one. They can cause high fevers and then symptoms just depending on the organs that they attack. But the problem with this one is that it lives in the environment well, and it's resistant to a lot of the traditional antifungals that we have.
Sure. So you mentioned that it was originally discovered in Japan, but it has made its way to the United States. You also said that in particular it's in Illinois. Do we know why this region seems to have a more...
So that's a difficult question to answer, and I'm not sure we understand exactly why. The three states with the highest outbreaks of this infection are New York, New Jersey, and Illinois, and I believe Illinois is second. Most of the cases have been in Chicago, in the Chicago area. There have been a few near St. Louis, a few in DuPage and Will County as well. As far as I know, we haven't had any in Champaign County, but I'm not 100% sure about that. There's been about 750 cases in the United States. In Japan, where there's been more time for identification and sort of study about this, it's a little bit better understood. We do know that the fungus tends to be unique to the continents that it infects. So our species and specific strain is probably different from Japan, for example.
Got it. But you know, you're talking 750 cases in the United States. It's still exceedingly rare.
It's a very rare diagnosis. It typically affects people with multiple medical issues, particularly those that were in the hospital. The big issue, though, is identification of it can be a challenge because it's a new thing, and so some of our traditional ways to identify fungus may misidentify this. So there's an ongoing CDC campaign to improve our screening for it, our identification for it, and then the big thing here is hospital infection prevention, infection control. That's really where, you know, the playing field where this is being managed.
Gotcha. And if it ever came to pass, unfortunately, that somebody did contract this, what exactly is the prognosis? We said deadly fungus. Is it necessarily all that deadly?
It is deadly, and it has a high mortality rate. Now, there aren't treatment options available, but it rapidly develops resistance, and that's the problem. So the traditional antifungals don't work well. There's a class of antifungal medications called echinocandins that can be effective, but in some people, it's not treatable. So we really want to prevent it. And again, I say that all the time, but prevention here is key. And a lot of that is really the focus is on hospital infection control departments.
Very good. So just keep an eye on your environment there. You know, make sure if you're, you know, putting mom or dad into a nursing home, it's in a good one, right?
Right. And this is another reason why doctors and everyone is trying to reduce the use of unnecessary antibiotics and antifungals.
Okay. All right, Dr. Kuhlenschmidt, thank you so much.
Thanks a lot.
We'll be right back.